Hello everyone! Today we begin an important journey into the foundation of diagnostic pathology and how tissue becomes a microscopic slide for diagnosis. Have you ever wondered what happens to a biopsy specimen after it leaves the operating theater and travels to the laboratory for processing? Surgical pathology includes both gross examination and microscopic review of resected specimens and biopsies to reach a tissue diagnosis. Histopathology refers to the microscopic study of diseased tissue, while histology studies normal tissue, and cytology focuses on individual cells. Today's lecture will guide you step by step through specimen handling, the gross room and lab organization, tissue processing, staining, and microscope interpretation. We will also emphasize essential safety measures and quality steps that protect staff and ensure accurate, timely results for patients. The process begins in the operating room or clinic, where the specimen is collected and properly labeled with patient details and clinical information. Accurate labeling and paperwork are critical to prevent misidentification and ensure the specimen links correctly to the patient and clinical question. Specimens are transported to the gross room in secure containers, often with a preserving solution or on ice for specific tissue types. Most specimens are fixed in neutral buffered formalin to preserve tissue architecture and prevent autolysis before processing. Fixation time depends on specimen size. Inadequate fixation can compromise diagnostic detail, while overfixation affects some molecular tests. Chain of custody, documentation of clinical history, and clear diagnostic questions help prioritize the work and guide processing choices. Grossing is the systematic macroscopic examination, measurement, and dissection of the specimen to select representative areas for histology. The pathologist or trained technician documents size, appearance, and any notable features, then inks margins when relevant for orientation. Representative tissue sections are sampled, placed in cassettes, and labeled to preserve orientation and diagnostic context for the slide. Safety is essential. PPE, splash guards, fume hoods for formalin, sharp handling protocols, and spill procedures protect lab personnel every day. Proper ergonomics and training reduce errors and injuries. Regular audits and safety checklists keep gross rooms compliant and efficient. Photographs and labeled diagrams are often taken at grossing to document findings and assist surgical teams in future review. After cassettes are filled, they enter the tissue processor where dehydration, clearing, and paraffin infiltration replace water in the tissue. Processed tissue is embedded in paraffin blocks to provide a firm medium for thin sectioning on the microtome. A microtome cuts sections typically 4 to 5 micrometers thick. Skill and sharp blades are essential for intact ribbons of tissue. Sections are floated onto warm water baths and mounted on glass slides, then dried before staining to adhere tissue firmly. Routine staining uses hematoxylin and eosin to reveal nuclear and cytoplasmic detail, enabling morphological assessment under the microscope. Special stains and immunohistochemistry are added when needed to highlight organisms, proteins, or specific diagnostic markers. Once stained, slides are reviewed by the pathologist, who assesses morphology, compares clinical data, and formulates a diagnosis. The diagnosis integrates gross findings, microscopic features, and clinical context. Clear communication with clinicians ensures appropriate patient management. Quality assurance measures include slide review, proficiency testing, and documentation of turnaround times to maintain accuracy and reliability. Laboratory information systems and barcode tracking streamline workflow, reduce errors, and trace specimens from receipt to report release. Digital pathology and telepathology enable remote review, image analysis, and archiving, expanding access and diagnostic tools for pathologists. In summary, careful collection, fixation, grossing, processing, staining, and expert review combine to produce accurate diagnoses that guide patient care. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, Connecticut, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.